So without further ado, we're going to kick things off, and I would love to invite Sami Mansfield up to the stage to start us off.
Good morning. Oh, all right, who's worried that I'm going to make you exercise? Okay. Who wants to exercise? Oh, well, we'll do a little bit, but we won't get crazy. So how is everybody? Sunday? Yes? Woo! All right. So I actually love these sort of opportunities to kind of think on the fly about what would I really love to talk about, because sometimes you just like to hang out with people, get to know them, and then be able to, Isaac's squatting in the backs. That was actually, make sure you really sit your butt down, just joking. But yesterday I let off, typically I only have 5 minutes to talk about the lifestyle pillars, and because of the schedule change, I get a little bit longer. So I want to refresh for those of you, we had a lot of information yesterday. Yesterday we talked really in depth about nutrition and exercise, kind of in the overall setting of thinking about the habits that you should have. We're going to talk about that very much towards lunch and our snacks today, because I want you all to think not just what you should eat today, but how does nutrition apply to the rest of your days, because it really is important to how we manage our energy. But today, we're going to kick off by talking about the other pillars, the ones that are beneficial for us, but maybe don't have all of this science behind them. So before we do, I like to start with this slide. On the left is this really interesting critter. Her name is Ruth Doodle Ginsburg. She belongs to me. She is what I call the notorious RDG. And that is her Wonder Woman costume, which we wandered around in downtown Denver on Halloween, just because why not? And then, of course, I think that a lot of lifestyle, in my mind, if I could think about why I do the things that I do, why I make the choices I do, why I try to give up some of the things that maybe feel good in the moment but don't help me long term, is because I want a little bit of this super person lifestyle. And so I think that's important for us as individuals, as well as the people that we support and take care of as patients. So let's dig into what I really want to talk about today, which is the other pillars. So stress management. How many of you know, or you hear yourself say, like, I'm feeling stressed, or I'm feeling overwhelmed, or I'm feeling frustrated? Does anybody know how many words in a Webster's dictionary or Wikipedia or ChatGPT there are for stress? Anyone guess? Not quite that many. No, that's okay, but doesn't it feel like it? There really are 19 specific words that we would think about, like overwhelm, frustration, fear. We talk about PTSD as kind of a subset of that, of what an experience maybe personally, our patients, ourselves. And so I always want to say to people, like, this is a very individual term that we try to bucket into one thing. Stress is acute versus chronic, meaning, I don't know if anyone had traveled in here, but I had the whole, like, the plane sat on the ground, they didn't load the bags, and then for whatever reason we had too much fuel, which apparently is a problem, right? And there were all of these little things, then we're late, my bag was checked, I had to grab it at the baggage carousel to get on the transportation to get here, and I missed it by 10 minutes, right? I could have gotten really frustrated about that, and that would have been an acute stressor that we could experience, but I was like, well, there's nothing I can do about it, and my next comment was, well, where's the food? Because I'm now hungry, right? It's how we handle those things, but there is chronic stress that we deal with in our lives, in our personal and our professional lives. Stressors are also healthy and unhealthy. Can anyone give me an idea of what we think a healthy stressor would be? I don't know if that's healthy or not. Whew. That is a perspective. Good one. Healthy stressor, yes. Deadlight? Deadline. Sorry, I was like, light? Deadline. Some people think unhealthy. I agree with you. Healthy. What else? What's a healthy stressor? Okay, love it. There you go. Let's think simple. What's a healthy stressor you can do today? Easy? Yep, any form of movement. Another healthy stressor is learning something new that you're thinking, wait a minute, hold on, how do I apply this? How does this work? It's a healthy stressor. Cold plunge, cold showers, healthy stressor. So I know it doesn't sound as uncomfortable or as comfortable, but these healthy stressors can really make a difference to balance things out. So what happens when we stress? There is actually, technically, some people say there's 4 Fs, I say there's 3, fight, flight, or freeze. We all have a propensity to do one of these, often 2 things when we experience a stress and we tell ourselves it's a stress. We get frustrated, we get angry, we get grumpy, we have an attitude, everything is bad. We don't want to deal with it. Like, I'm not going to talk about it, I'm just going to ignore it, I'm going to go do something else. Socially accepted stress management is what I call the bottom, which is the freeze behaviors. I am not judging you when you want to scroll social media, when you want to binge Netflix, when you want to have a glass of wine. When we do it for stress management, I remind us that there are better tools, and these should just be tools that we are doing because we want the pleasure out of them, not because we're kind of creating a numbing behavior for stress. I go back to saying, in our house, we have this term that we call gravity. We all know gravity, right? It's this thing that keeps us here. So this came from my spouse, who doesn't do any of this, would never stand on this stage, but he had brought this from his career in software, in developing software programs, of like understanding you could build something right and it wouldn't work, or you build something and it wouldn't work. And so he said, I learned this term and I tell my team it was gravity. Gravity was the thing we can't control. So in our house, we always say, if there's a situation, is it gravity? Does it go in the gravity bucket? Can I control it? Let me ask you this. How many things in our world do we think we can control? 1 to 3, 5 to 10, everything. A little bit of something. What do we think? 1 to 3. What we think, how we respond, how we interact. That's about it. So it can be very freeing to sort of let go of the things that we cannot control. So again, grumpy people, grumpy situations, that email that comes in that just drives you nuts and you really want to respond. It's really taking a moment to think about this from a stress management strategy. However practical, I love practical, I'm all about practical. I really want us to think about what is something that we can do in the moment or to prepare ourselves for stress management. And so I go back to breath work. For someone who's been in this field as long as I have, I was very slow to uptake. I tell people, they'd say, what do you do for stress management? Take a walk, go to the gym, right? Move. That's how I respond. And I finally had someone in a career situation say to me, how does that work when you're on a meeting, sitting in a meeting and at a meeting table? And I was like, ooh, doesn't work. I just become fidgety, right? I'm in that sort of flight behavior, like I want out. And so she said to me, we've got to find you a strategy that you can do anytime, anywhere. Do you know what that is? And I was like, I have no idea, right? This is halfway through my career. She said, it's breath work. And I was like, well, that makes sense because I come from the movement space, breath to movement. It's one of the reasons that yoga, Tai Chi is such a powerful mind-body exercise. So it came back to breath work. Breath work is great. You can do it anytime, anywhere. We're already doing it. So how many of us like to optimize what I'm already doing? Why add one more new thing? It actually allows us for what I say, rest and digest, which has to do with food and mood and a lot of other in-depth here. It has a lot to do with lowering our stress hormones. And honestly, if we practice regular breath work, it's prepping us for when that stressful situation comes, that email comes in, you miss the flight, your kids call, and everything is falling apart and you're halfway across the country, right? We've all been there. And in that moment, it's how do I handle this situation? It allows us to be calm. So there's a lot of things you can do for breath work. I'm going to give you a couple of tools that I find to be the most useful because I don't always have 15, 20, 30 minutes to really do breath work. And again, if you give me 15, 20, 30 minutes, my butt's probably going to be doing something different. And that's just me. However, if you like to do longer breath work, it's amazing. Just know you. So here are some of my options. When you're in that moment and you're like, I'm feeling stressed and I just need to calm, the best thing that you can do, or one of the quickest things that you could do, probably not the best, is to hold your exhale longer than your inhale. So just try it. Inhale, and then we're going to exhale on a count of 5, 4, 3, 2, 1. Just do it one more time. Inhale, exhale 5, 4, 3, 2, and 1. It's like, okay, right? Simple, actionable. You could be sitting in a meeting with somebody or stuck in that space, and you can do that right then and there. So it's a great tool to have. I also really like the idea of using breath work when I'm sort of in that, I don't really feel like getting going, I need to do this thing, I have a deadline, I need to maybe energize myself. And so that kind of quick sip of air, which is just that, and then relaxation, let's try that on the opposite. So just, and then exhale. That will help give you that energy because you're pulling that oxygen into your body and your brain. If anybody does cold shower, cold plunge, do you know what happens when you do it? Right? My body is sort of having that response. I'm trying to get warm and pull energy to kind of adjust to that temperature change. There's a lot of other breaths, the yoga breath, box breathing, the real-time de-stress. I stole this from Andrew Huberman, if anyone knows Andrew Huberman, one of the great neuroscientists making people like me understand neuroscience. I love that. Really talked about the evidence behind pulling these two breath pieces together, doing 2 quick inhales followed by a long exhale. So that is what the science has shown us to be one of the quickest ways. It's not going to give you sustained benefit, but it is the quick fix. This is better than eating the chocolate. I mean, it's not, but it's better for the body and the mind than eating the chocolate. And then my last one is kind of this, what I call the happiness, which is the deep sigh. So think about the cutest thing that you've seen or the thing that just makes you smile, the happy place. Just take a nice breath and then just, ah. So everybody do that with me. Ah, right? Let's do it again. Ah. And you're like, oh, that's great. It's that thing that just makes us feel good, and it really gives us that moment of happiness. Another kind of tool that I've been really using with, again, colleagues, for those, I started this really when I was doing so much traveling to time zones, and it was like I couldn't quite adjust. And I really, again, heard about this Yoga Nidra side in so many different spaces. Yoga Nidra is basically a meditation where you do a body scan, and it's in a meditative, comfortable state. It could be ideally laying comfortably, but it could be seated, and it is like having a little nap. So this is a great tool. You can find tons of videos just on YouTube and audios on Yoga Nidra. I've used it with a lot of my, again, colleagues, and I've used it even with a lot of my patient work. So let's talk about the next pillar, which is sleep. I love and dislike talking about sleep because I feel like sleep has this very perfect definition according to a lot of our national organizations of what great sleep is. And then I look at that list and I'm like, I fail miserably many times. And so I've really changed this to think about if we can strive for 3 out of 5 of these components of sleep, we're doing pretty good. The last one also, I put subjective, that is Sami's edition, not any Academy recommendations edition, because I don't know about you, but I am a morning person. I wake up with this personality. Does anyone like have that personality or opposite? Like you would not want me in your house, right? So the people, I'm like, do you wake up refreshed? Melody's probably like, not really. Like it's just not how I wake up. Again, I'm married to it. So I come up, I'm a 10, RDG, 10, husband, slow roll, right? So I don't speak for about 2 hours. Just smile along. So we have to know what our tool is. What matters for sleep? The number one thing that matters for sleep is routine. So 2 things about routine are what we do in the morning and what we do at night. I count that as one because I call it the bookends. Do you know that how you sleep tonight already started? It starts when we wake up. So I give people my top tips, which is drink a glass of water because guess what? We get dehydrated overnight. Yes, I love my coffee. Drink water first. I know it's painful. I put it out overnight. I do the same thing in the hotel, so I will go for it. Then, coffee if you want to. Get light within at least 10 minutes. Again, we come off of winter. It's often going to have to be artificial light. Flip the lights on. If you can have a great lamp that will mimic natural sunlight, wonderful, but if you don't, just flip your lights on. I also really tell people, move 1 minute. Just move your joints, stretch, reach, walk around your kitchen, just move your body. You can even do this lying in bed. And then the last thing really is your mindset. Your mindset in the morning has a lot to do with your night and your sleep. So it's even that simple thing of it's going to be a good day, even if you're like, this is going to be a hard day. It's great to tell yourself it's going to be a good day. The second thing is about the routine is thinking about what you do at night, both your last 30 to 45 minutes before bed, doing activities that are enjoyable, not trying to maybe get on the news, maybe not trying to catch up on all your work email, right, etc. If you like to read on technology as I do, try to do it in the black tone of that, the night setting versus the daytime setting if possible. But again, really thinking about that last hour and then also have the same routine before bed really helps. Your body starts to notice your routine. So if it's like you brush your teeth and then I'm like, okay, that's when I put lotion on my face, or I set my bed up a certain way. The thing I realized just this last week, I was laying in bed reading, I'm like, why am I not sleepy? I always use a sleep mask. And for whatever reason, I've done this for years. I forgot to put the little thing up on my head. So then I'm start like looking for the sleep mask. My husband's like, what are you doing? And as soon as I put that sleep mask on, it was sort of sitting there. My brain was like, oh. And it was really interesting because again, I've done this for years and it was just for whatever reason that night, I was squirrel braining. So you have to think about that routine as well. Lastly, I talk about daily living. So the two key pieces are stress management and how much activity and sedentary time you have during the day. So if you are seated all day, it really does affect your sleep quality and quantity. And there's a lot to be said about how that body works together, and then we go back and refresh and restore. So when you're like, I can't sleep, routine, good, Sammy, I got it. I really want you to think about what you're doing during the day, okay? All right, social connections. So this one, you might wonder, this image on the top right, what does that mean? Does anybody know what this means? Let me ask this question. So we know that the amount of isolation and loneliness and disconnection that we have in our country is equivalent to the health hazards of smoking a pack of cigarettes per day. This is especially prevalent in, I see healthcare professionals where we're just busy, 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 busy. I've got things to do, and then I've got to do the family, and then I'm going to find time for me, right? And we see this in a lot of the patients that we care for. And the American Cancer Society published really strong research. They did their first poster, I think, in 2023 at ASCO, and again presented in 2024 on the same thing. So this is one of the biggest challenges we face, and it seems so easy, yet it's really difficult, to think about, okay, connection. So isolation and mortality is one thing. We think about our on-demand life. I know I always feel like this. I'm like, okay, where can I multitask? We often kind of forget ourselves and like what makes us happy. I think also like when you're in these weird career time points, sandwich generations, like, is it for my parents? Is it for my kids? Is it for, what am I doing? Like my culture has totally changed. Like I was a soccer mom, am I still a soccer mom? I don't really know. And so I think it's really interesting in that piece. And then also I tell people it's also thinking about who's in your circle. We have a lot of circles that we don't get to choose. I think we need to choose some circles that are important to us. So these are a couple of my tips. I debated about pulling some things off, but I'm gonna just leave this all up here because I think it resonates with a lot of us in different ways. So there's two sides of this. Number one has to start with us. If you don't really know what you need in your circle, who you need in your circle, what your day needs to look like, you are not going to find that connection with yourself and then with others, right? So I think that's really important to think about the things that make us happy. Even if you can only take 2-3 minutes a day to do something that makes you happy, we need to do that. And I think this honestly should be also a stress management side. And I know it's hard to make these pivots. It's really hard to make big pivots in your life. So the more we can just move away from the things that don't serve us and towards the things that do, it's okay. Slow is best. I also say no. I say this a lot. No is a complete sentence. So I am really good now in my career when people ask me to do something and it's like doesn't really fit. I will say no, but I say it in a nice way, like, I am unable, but let me introduce you to someone. So I find that to be good for me as a professional to say no to something that doesn't really fit what I want to do, but also build up other professionals that may be trying to build their career, and so I can actually feel like I'm mentoring someone. But for a long time, I was like, I have to say yes to everything because if not me, then who? Which is so ridiculous, right? And I think that's part of what I really have learned, but also saying no frees up time to say yes. Yes to you, yes to the things that you love. So I think this is probably one of the most important things that we can do. I have several colleagues who will ask me to do things. I'm like, sorry. And I had someone recently tell me, you're just so good at setting boundaries. And the way she said it kind of, and it was, we were talking, kind of rubbed me a little bit of the wrong way. And I said, I'd love to hear more about your thoughts about my boundaries. And so she looked at me and she goes, honestly, it annoys me. And I was like, tell me more. And her comment was, I'm not good at it. And so it frustrates me because I'm not good at it and you are. And I said, you should just try it. Because this is someone who never says no. It's not that hard. And honestly, it really is one of the simplest things we can do. And then also, when we're like, I can't control any of my day, my time, I like to really go back to the power of gratitude, and simple gratitude is really good to bring down our parasympathetic nervous system and our stress. So sometimes it's just like, I'm just grateful for today. This is one of my go to sleep habits is like, I'm really just grateful for today. Simple, easy, doesn't have to be fancy, but if you want to go grand, grand is also good. Lastly, I think about the communication that we need to have about social connections. We need to be better at telling people what we need and don't need, and setting those boundaries, even when it's hard. So I really think it's important to think about that, and then also stepping back when we need to. It's amazing how many of us have this struggle, and I do, but I don't, with, I've got to know everything that's going on in the news. I'm like, but do you really? Because honestly, sometimes we do these things and we don't step back from these situations, and I'm not sure why. I think it's just a habit, and sometimes we let those toxic people influence how we feel in the toxic situation. So my last piece on this is this: ask yourself, what is it you need for social connections? So I have 4 categories that I teach really mostly my patients, especially when I'm trying to get them to make a lifestyle change. And often when they feel disconnected, they don't have a community of people that are gonna support them to make these changes. So I'm like, here are the things that I think you need. You need the person, the thing, the habit that you can just, that I call the listener, that you can just spew it all out, right? If you have that person, you're like, let me just call you, and I just talk, and they listen. I will tell you, I don't feel like I have a person to do that. I have RDG. She's the best listener ever, right? Great listener. I feel like I can write about it or write it down in a journal, but sometimes it's hard for me to kind of do that in an individual level because I feel like I need to be two-sided. So this may not be a person. This may be a scenario. We need an encourager, that sort of person, that thing that's gonna be like, you can do this, you got this. They're sort of like your cheerleader, your pom-pom squad. It's a girl thing, but you know what I mean. We need sort of that inspiration. I think this is really an interesting side in what we're seeing in our field, that people are making career shifts. And I hear so many of my professional colleagues feel stuck. And then when they hear someone else has done the thing, this sort of new idea, they're sort of inspired, like, oh, wait, if they can do it, I can do it. We see this in cancer, but I think we need to look at this professionally, of the people that are sort of setting the stage, maybe making the road. One of my loves of being part of the American College of Lifestyle Medicine and seeing all my clinicians come in, we are 50% clinicians, is watching them get inspired to see professional change from someone else, maybe in a similar scenario, and they now feel like they're not on an island or pushing the boulder by themselves. And then lastly, we all need this. I know this is hard. We need a nudge, not a kick, a nudge. The person that's gonna call you out when you are not being true to what is important to you. I think that's one thing that's hard for us. And so those of us that, there might be a few type A people in here, maybe a couple, right? The people that don't challenge you, right? So people will, I'm like, I need a nudge. And I finally had to tell a good friend of mine, like, I made some comment about, I don't know why when I have like a bad day or a bad week, people are like, Sami, just give yourself grace. I'm like, I don't know who this grace thing is, but like, I need someone to be a nudge. So this really good friend of mine who also went through some massive career changes, she's like, oh, I'd be happy to be your nudge, Sami. This sounds fun. I'm like, great. But I had to tell her because she said, I didn't know what you needed from me. Lastly, risky or unhealthy habits. I talk about this a little bit. I think it's important for us to think about where we can do less, not more. So overall in lifestyle, we talk mostly on tobacco and alcohol. In cancer, we've really expanded this to think about sedentary behavior as a risky, unhealthy habit. So the more that we can just move a little bit during the day, the more that we can just kind of get our body moving in a seated position, whatever that may be, great. Sugar-sweetened beverages, I say this as added sugars, but the data that we use in oncology is much more driven by sugar-sweetened beverages, so that's why that's here. If you look at the sugar content of the added sugars of the foods that we eat, the recommendations, American Heart Association recommendations, are 25 to 35 grams of added sugar per day. The average American, where do we think we are? What did you say, Melody? So there's the averages that I've heard last reported are around 90 to 100. I think that's a farce, honest. If you walk into Starbucks and you order a vanilla latte off the menu, grande, 35 grams of added sugar. And I think people just don't know, right? They haven't read all of those labels. I talk about unnecessary medicines and supplements. I think often, and I do my health span and talk about health span conversations and really my evidence in health span, you all have heard me talk about this. I know people take supplements often because they want to improve how they live. And so I do this both in the patient side and with professionals. Often we take things, I'm like, why are we taking this? Do we need to? And I say this actually even as we age, not that I'm aging, but I feel like I'm aging, that when you are looking for a little bit of pain relief and we quickly take these NSAID medications, they actually slow down our muscle tissue repair, our connective tissue repair. So it's like I kind of have to really think to myself, do I really need this, or does it just sort of be something that's a habit? So that's an example. And then of course, protect your skin, because we need to make sure that we're protecting one of our largest organs as well. All right, so last couple things. What holds us back from making these changes? So these are a few of the things that I hear from people kind of bucketed in. We're looking for the thing that I can do in just a minute because that's all the time that I have. I'm uncertain, is this the right thing? I can't do everything. The exercise recommendations are here, the nutrition guideline or the recommendations are here, and I can only do a little, I'm not doing anything. I think that's one of the big problems that we have, is we want to be perfect, right? Don't let the good be the enemy of the great, or the great be the enemy of the good, right? We need to think about good as okay. And then also non-productive idleness, I say this is to be like, quit scrolling Instagram looking for the perfect workout, right? Or the perfect meal plan, because it does not exist. I think it'd be nice if it did. And lastly, not valuing our time well. We do not get today back. So I really value being here. I'm always extremely thankful that Total Health has believed in my mission for the last 5 years that I've been doing this work, because I really feel like when you come to learn and get this extra moments for you is tremendous, because your time is valuable. Today doesn't come again. So I think it's important for you to think about that as well. Does anybody have anything else that they want to add that maybe is like, holding me back? You want to have anything? Like, nope, I'm good, Sami. Please don't make me squat again. So I love this book. If you've not read this book, this has been one of my favorite books I always go back to with behavior change, is the Atomic Habits book. There's a lot of free things that go out there. I actually don't like more emails, but I like the Thursday email that James Clear writes. I like the idea of small habits. He talks about habit stacking and other just really actionable tools. So I tell people, when you're thinking about lifestyle, where to start, just start. Whatever you could do in the moment. If that means when you go pick up your breakfast, which I get to help you through, not food police, but guide you, making one better decision is on the path. That's great. Leveraging bigger wins, what I mean by this is it's hard to do everything, so leverage the thing that's gonna mean something to you. So if you really wanna work on social connections, leverage that first, because if it means something to you, it'll drive the rest of your habits. Thinking simple, and then for those of you that remember my slide from yesterday, don't lose the forest for the trees and cage up the chimps, which are your distractions. We have so much more time and energy when we lock out the things that don't matter, that are just distractions. Small, consistent habits, and then do you. Don't do what Sami thinks and what I do. Do you. It's really an important thing to be authentic to that side. Does anybody else have any, I was like, habit, things that they found to be useful? Okay, you could, no. All right. Does anyone have any questions? Quiet. Okay, everybody stand up. This is not gonna be horrible. We gotta move a little bit. Let's just turn side to side. Turn side to side. As you turn, reach, don't punch anybody. You can push them over if you wanna check their balance. Good. Plant your feet, reach your arms up. Reach them behind you, stretch back, look up. Now just push those arms forward, stretch out those shoulders. And now put your palms on your low back, fingers pointing down, and push your hips forward. Okay, let's just turn side to side again. Oh yeah. I gotta make sure they're awake. You're welcome. Okay. All right, everybody, awesome. I did add, if anybody has, I put my contact information on here if anybody wants it. This is also, Jessica, uploaded in the slides, right? Or in the app? All the slides that I presented yesterday and today are also uploaded in the app, so if anybody wants them, they are available. Just for fun, for anybody that needs, like, okay, I need the checkbox on YouTube, every Friday I put out a 5-minute workout on YouTube from my living room, usually with Ruth, who does nothing but lie on the couch. I swear, you'll see it. But it's a good, quick thing that I really started doing more for the patient-facing side, but I found a lot more of my professional colleagues like it. So just giving you those resources as well. All right, I am out. Jessica, I'll pass it over to you. Thank you, everybody. I'll see you a little bit later.